Pregnancy is a stage in woman's life which makes her vulnerable. According to a research, women have distinct nutritional requirements throughout their life, especially before and during pregnancy and while breastfeeding, when nutritional vulnerability is greatest. Ensuring women have nutritious diets and adequate services and care is fundamental for the survival and well-being of mothers and their children. This is one of the prime targets of the ANRiN project in Nigeria. ANRiN is a short form for Accelerating Nutrition Results in Nigeria. It is a project funded by the World Bank in partnership with Global Financing Facility and International Development Association, with support by the Nigerian government. The overall project objective is to increase utilization of quality, cost-effective nutrition services for pregnant and lactating women, adolescent girls, and children under 5 years of age. ANRiN is implemented in 12 high malnutrition burden states of Nigeria, representing all 6 geographical zones of the country, thus Abia State, Akwa Ibom, Gombe, Kaduna, Kano, Katsina, Kogi, Kwara, Nasarawa, Oyo, Plateau, and Niger States. ANRiN was introduced in Niger State in the year 2018. However, the services were properly implemented in 2019. This was further expatiated by the state's project manager, Shehu Muhammad Esugaye.
ANRiN is saddled with the responsibility of providing basic package of nutrition services to targeted population in Niger State, that is the children under 5 and women of childbearing age, as the pregnant women, and we have been supplemented with a lot of nutrition packages ranging from for the children under 5, so they are to be supplemented with vitamin A, albendazole, and micronutrient powder, and zinc ORS for control of diarrhea disease. We also provide the under 5 with other nutrition services at hygiene, because the caregivers were given nutrition education through counseling. The women have been supplemented with iron folic acid and sulfadazine pyrimethamine for prevention of controlling of malaria, and also nutrition counseling on how they are going to eat their foods and how they are going to use their own local available food within their domain, so that they can get all the nutrients and vitamins required for the general growth and even the development of fetus, so that at the end of the day, the pregnant woman can be nutrition secured, so that the one at that end of transition of 9 months carrying the pregnancy, she can give birth to the baby with ease, and that will help in controlling the anemia in pregnancy. and other malnutrition related to pregnancy during that 9-month transition. So you can see these are all the packages the ANRiN is targeting at. And we are doing this so as to ensure that this group of people who are vulnerable in the community, in the society, are being nutrition secured. You know, the children under 5, they are the foundation, they are starting. The pregnant mother movement is the foundation of bringing the children under 5 to life. And as you all know, if the foundation is not well laid, automatically the buildings are bound to collapse at the end of the day.
The program covers the 25 local government areas of the state, with the 2 implementing partners, that is, African Youth Growth Foundation AYGF and Plan International. The project has since gained dominance and acceptance in all the implementing communities. A chat with some of the community leaders has further attested to this.
Alhamdulillah, gaskiya an samu nasara kwarai da gaske tun lokacin da aka introducing wannan shirin. Mata masu juna biyu kuma suna karban wayannan magunguna, kuma an samu sauki wurin haihuwa da sauran jinyoyi nasu haka.
Sun taimaka ta bangaren mata masu juna biyu da yara daga haihuwa. In fact, wasu programs ma da suke kawowa suke sensitizing mutane ma akan maganar shayar da yaro, breastfeeding daga haihuwa zuwa wata 6. Abu ne wanda yake ya samu karbuwa daga jama'a sosai, domin mutane sun yi abiding by wannan, har an dan samu sauki a wajen irin abubuwan da ke faruwa da mata masu juna biyu da kuma wajen shayar da yara. So su ANRiN gaskiya sun yi kokari wannan magungunan da suke kawo ana amfani da su yadda ya kamata. Muna kuma samun alfanun abin da suke bayarwa.
The benefit, because this we are talking of community, and many people are involved in the system, and they enjoy it seriously, because some of us here that we have a pregnant women around, if they make any comment, in fact, is that we translate that to our own language and say, we are very, very grateful, because the assistance is not something that we can even measure. Yes, it's above measurement. So we thank government very well.
ANRiN project is domiciled in some local government health facilities across the implementing local government areas in the state. The health workers, on their own part, ensures proper sensitization to the clients. Especially in rural communities, it is a serious challenge to attend healthcare facilities during pregnancy due to obvious challenges ranging from traditional beliefs, sometimes lack of health facilities, or financial difficulties.
Before this program came into existence, you find out that a woman ignorantly knows that her baby has malaria, but she doesn't have the fund to go to facilities, to access facilities and procure drugs. But now with this program, we have less cases of convulsion in children with malaria.
In an attempt to achieve the set target of reducing many health complications during pregnancy and after childbirth, the non-state actors, who are the implementing partners, also engages community volunteers drawn from every benefiting community to amplify the message and facilitate understanding of the project by members of such community.
My role as a mother-to-mother facilitator in Kurumana Ward is to make sure the CHV do the right thing. We normally conduct monthly meetings with the CHVs, as well the beneficiary of this ANRiN intervention. So we make sure that they number the house properly, and we check their register booklets and ensure that there is no any error attached to those register booklets.
I'm in position to collect drugs, to transport drugs from the state level down to Bida HGA for distribution. We are very happy. We are happy. Even the pregnant mothers are happy. The community, the entire community is happy because I can tell you we are no more recording low birth weight. Our pregnant mothers are giving birth to healthy children. No more miscarriage here and there. There is no any record like that anymore.
We enroll the child first. So we enroll them, collect their biodata, we fill the card for them. Then after we insert the biodata in app and also the registers, then we provide these services. The services will pop up and we provide the services to them. These are the services. For children, we are providing deworming, vitamin A, micronutrients powder. There is different age groups of giving these commodities. For the vitamin A, we have two categories of vitamin A. We have the blue capsules and we have the red capsules, which is different categories of age. We give the blue capsules is 100,000 international units, whereby the red one is 200,000 international units. We give the blue capsule to a child right from 6 months to 11 months, whereby the red capsule, which is 200,000 international units, we give the services to child from 12 to 59 months because they are the vulnerable age. We are targeting those ages because of their immunity is low.
Every local government has directors, focal persons, monitoring and evaluation officers, and other key officers who play key roles in monitoring and supervision to ensure the stability and effectiveness of the ANRiN project in their locality. Many of them have explained their strategic roles and observations regarding the project.
The ANRiN program also, we have so many we have so many groups in our community that are really helping us in carrying out this program. Most especially in the Chanchaga local government, we have support group that we form in our communities that help us. This group help us to mobilize women and their children to go to the health facility and assess these interventions.
Because the volunteers go from houses to houses, and in fact they welcome at any time any beneficiaries that come to their door, except when they are out of stock. So we have really seen the benefits.
You know, ANRiN services is an integrated services that has been taken along with other integrated activities such as immunization. So with that, with the ANRiN integrated into immunization, antenatal and other things, patients come out to benefit because most of these things are free. All are free. And the staffs are ready to do what actually is needful of them.
Positive impact about the ANRiN program is that it has increased the number of our antenatal visits to our facilities in the HGA because of the free commodities that when they come they get. Because even 10 naira or 100 naira that they can use to buy the routine drugs from the outside can prevent them from attending the facility. But with the free commodities, fasole, folic acid, fansida, there's turn up and the antenatal services in the LGA.
And we create a lot of awareness on this malnutrition. So we don't have issue with the non-compliance. In fact, mothers are even rushing to receive the commodity being supplied to them for the benefit of their children. So we thank ANRiN with this project because our children are looking healthy.
A number of women from various communities have attested to the significance and impact of the project in their lives. They see it not only as timely intervention, but as a life changer. Through the project, many lives of women and children have been saved and nurtured.
matsala kaman makamanci haka nan ba amma ko da yaran ba su da lafiya mun yi mu kai su su ba mu magunguna su ba mu allurai kamar da suka dace kamar da kuma ya kamata sukan ba mu
sosai me ku kwa majewe game mu bi zako warbe yin kuma gaskiya su ba shi mai ko yin da kuma wannan lafiya lalla sai to bai yelo gwamnati abin jin do ozan wore jin ganewa o zaman wala goce ya nalo dan Allah wala in wa ba gabi in kwa bon jin nai kuma yelo gwamnati abin jin kwa ci gaba ya shi ba ga in kwa abin jin ko ma bi jin no
imelo asibiti imaga to en la ci beje imaga jin ni charge àǹfààní ele lafiya bacin mutu
kuma wali suna ba mu shawararki da abin da ya kamata mu ci lokacin akan duk lokacin da ka samu ka dauki cikin har lokacin da Allah da zai zo ya sauke ka sannan kuma su je ga shayarwa suna gaya mu kowane irin da hanyar da zamu bi kuma wallahi muna bin hanyar kuma muna ganin yanayin canji.
And that letter it helps her a lot as a child. Because if you come back and ask her what they teach you, say they teach her to do exercise. Sometimes they give her medicine, and it helps her and both the child. It helps them truly.
We are so much happy about the intervention, so to say, because basically we used to attend private clinics and what have you. But with this effort, I think it's a plus to us, considering the fact that the economic aspect of the country and what have you. So we have been, in fact, it has been a plus to us, all true.
Gaskiya ina zuwa awo kuma ina shan magani ina jin daɗin shi, musamman wurin haihuwan ma yakan zo mu mace da sauki sosai. Inda ta sha magani akan dokan da aka rubuta mata ta sha.
Yana da kyau mazaje musamman waɗanda suke da iyali hakan ga su dinga kokarin tura matayensu suna zuwa waɗannan asibitoci suna samun wannan magunguna na tallafin nan kyauta saboda gaskiya yana da amfani sannan kuma yana rage ma mutum ma shi makaran kanshi mai gidan wani su abubuwa na kashe kuɗi sannan kuma gashi nan magani kuma yana da kyau.
Health personnel in charge of most of the identified facilities shared their experience about the project and reveal how the intervention have succeeded in improving the flow of clients in their facilities.
First of all, before any other thing, we used to counsel them. We will tell them the importance of antenatal and other things. And there are drugs that we normally give them. We will tell them the importance of the drugs. What the drugs does in their body, especially these routine drugs, we explain to them one after the other. We have that of SP, that is for malaria, to prevent malaria. We tell them, and after giving them, we tell them, it doesn't mean that you will not sleep under treated mosquito net. After taking this one, you have to sleep under treated mosquito net again.
We appreciate the commodities ANRiN people are providing to us to give our pregnant mothers and under 5 children. So we appreciate it, and ANRiN is very good.
Well, if I can say, I think this is almost 3 to 4 years now that we have been running this program of ANRiN, and the program actually it has improved, especially with the turn up of the women that are coming for antenatal care.
These has also been consolidated by the chief focal person for the state, Fatima Isa Isako.
I work with the nutrition focal person in the 25 LGAs in respect of nutrition. I coordinate the activities of nutrition in the 25 LGAs with the nutrition focal persons. We have the community volunteers. These community volunteers will go out to the community and sensitize the women, tell them to come to the health facilities, because ANRiN SPSCD activities is mainly in the health facilities. So these community volunteers will go to the community and help educate the women on the importance of coming to the facility. So when they come to the facility, they will take the commodity free. And also for follow-up, sometimes some will not come. These community volunteers will go to the facility again and help to educate them to come back. At the health facility, a follow-up date will be given to them. So this community volunteer will also go and track them. If they didn't come, they will come back to the health facility and receive the services.
A research has also revealed the situation of malnutrition in Nigeria. 1 in 3 of children under 5 years of age suffer from chronic malnutrition. This translates into 13.9 million Nigerian children at the risk of either dying or not developing to their full potential. Macronutrient deficiencies, mainly vitamin A, iodine, iron, folic acid, and zinc, are a serious problem. Despite their high cost effectiveness, coverage rates of micronutrient supplementation and fortification remain generally low. It is estimated that 60% of Nigerian children are at risk of vitamin A deficiency, whereas 68% of children and 58% of pregnant women are anemic. 7% of children suffer from acute malnutrition nationally, a fifth of the children suffering from chronic malnutrition. 10 of the northeast and northwest states have rates of child stunting as low as 17%. It is no longer news that the ANRiN intervention have drastically dropped the statistics to the barest minimum. This indicates the successful implementation of the ANRiN project across Niger State. The impact felt has left many families and health experts clamoring for its sustainability.
For further recommendation, we actually want you to expand this, you should expand the scope so that other facilities who are not referral facility can enjoy the services.
Some of the health facility we have, if the project can as well supply all this commodity to our various health facilities, we will even be very, very grateful, because it's a very higher achievement that we got at Shiro local government.
We need to sustain this program because it helps our people. And since then, we have not been having much issue on anemia in pregnancy, as I've told you before. Even the women children, especially Fulani people, when they come to clinic, say about magani shusha and chiki. You see, they will be rushing because their children are growing fine. They don't have problem of worms in with the children again.
Accommodation is continuity, sir. Continuity, because if our people, especially we are in urban, if they see anything free, they appreciate more and the turn up will be good. Because despite that we are in urban and things are hard, but with these free drugs, routine drugs, in fact even the women's are appreciating.
One of my recommendations is that all facilities should be covered, and not only referral facilities, even other facilities, because they also attend to antenatal cases. And there should be prompt supply of the drugs, and there should be support, because some women will even tell you they don't have support to come to collect the drugs. Maybe when they are a little support, maybe when they come, it will even encourage them more.
My recommendation now on the ANRiN to go forward now is they should put more Now before the drugs is only the routine drugs. Now if they can now help, maybe in terms of during labor, maybe they can add to these mama kits during labor. I think it will boost more of the antenatal.
The first phase of the project is expected to round up in December 2023, while there is every possibility for the sustainability with continuous support from government at the state and federal level. However, the state project manager also crave for the need to go back to the natural foods for healthy nutritional benefits.
Already, community volunteers, they are used to these commodities already. They have been sensitized on how to use local available food resources. Because these food resources, our local food, also contain all these vitamins, vitamin A, and other essential vitamins and nutrients. So, supplementation of this is an interim, and it cannot continue forever. So that is why we are now preaching heavily on the nutrition education to the community, so as they can now go back and start eating right, using their own local food to meet nutrition norms. Already, all these interventions are supposed even not to come if we have been eating our right food. But you can see in this our modern society today, we now even imbibe the spirit of consuming highly refined products, leaving our own local food that contain the essential nutrients that our body require. All these for the highly refined products, they have been preserved with preservatives, chemicals, to improve their shelf life. And all these preservatives are chemical in nature, and they also have their negative effect in our body. Then the government on that side, we are making a frantic effort to see that government cannot come in after the ANRiN expired, so that this activity can continue. Iron and folic acid supplementation for pregnant mothers, women, then vitamin A supplementation, and prevention of malaria diseases. Government has done that because government support by providing treated mosquito nets and supplement the pregnant women with SP to prevent malaria. So government has been doing very well on that aspect also. But we want to, the way we are doing it, meeting the community, using the community approach, when the government could continue with that tempo, so that in the next 10 years, people may not even need the drug again. They prefer to go on their natural food. Because realizing that, yes, so I need to consume this food to meet my nutrition norms. So this is how ANRiN is being structured.
The project, through its strategic partnership, is reaching more children and women and saving lives by providing nutrition services to children under 5 years and teenage mothers during pregnancy to support optimal gestational weight gain and also reduce the risk of gestational diabetes, increase birth weight, reduce the risk of anemia in late pregnancy, and lower the risk of preterm delivery. Many of these have been achieved over the years. Since the commencement of the ANRiN project, the ultimate safety and healthy living condition of mothers and children is the desired goal of ANRiN.